10 seconds, 5 seconds. India is one of the developing countries in the world, having 1.3 billion populations, of which 70% and 30% population lives in rural and urban area respectively. Currently, India in a state of epidemiological health transition, that is, India is facing dual health problem of communicable diseases as well as non-communicable diseases, which remain a threat to health and economic security. This health transition is due to change in demography of population, global warming changes, social and economic detriments of health. In India, many people are dying because of lack of access and poor quality of medical treatment. In this developing country, day by day, the expenses on health care are increasing, especially in people living in rural areas and in smaller urban towns, and the annual health related expenditures ranged from a few hundred rupees to a maximum of 10 lakh rupees. Also, in these areas, the individual are traveling long distances to access and avail the comprehensive health care services. The Government of India announced Ayushman Bharat Yojana, National Health Protection Scheme, in the year 2018, that will be rolled out across all states and union territories in all districts of the country. The main aim of this program is to providing a service to create a healthy, capable and content new India, and it has two goals. First, to creating a network of health and wellness infrastructure across the nation to deliver comprehensive primary health care services. Second, to provide health insurance cover to at least 40% of India's population, which is deprived of secondary and tertiary care services. Under this scheme, all types of medical treatments will be provided except organ transplantation for those eligible families. The benefit cover will also include pre and post hospitalization expenses, and there will be no restriction on the size and age of the covered beneficiary family. The payment for medical treatment will be done on package rate basis. The package rates will include all costs associated with treatment, and transactions of money to the beneficiary will be paperless and cashless. The beneficiaries can avail benefits in both public and empaneled private hospitals. The estimated cost for the scheme is about rupees 250 billion over 2018-19 and 2019-20 years for both center and states. One of the core principles of ABNHPM is to cooperative federalism and flexibility to states. This scheme will cover poor below poverty line families, deprived rural families, and identified occupational category for urban families as per 2011 socio-economic caste identified occupational category for urban families as per 2011 socio-economic caste census data. This scheme will be covering over 10 crore families across the country with a health insurance coverage up to 5 lakh rupees per family per year for secondary and tertiary care hospitalization. This scheme clearly defined the deprivation criteria for rural BPL families or deprived rural families. These criteria are families with only one room with kacha walls and kacha roof, households without shelter, destitute, living on alms, manual scavenger families, primitive tribal groups, legally released bonded labor, families with no able-bodied adult member, SC/ST households, families with no adult member between the ages of 16 and 59, to female-headed households with no adult male member between the ages of 16 and 59. For urban areas, 11 defined occupational categories are recognized. ABNHPM will be implemented through ongoing centrally sponsored health insurance schemes like Rashtriya Swasth Bima Yojana and the Senior Citizen Health Insurance schemes. This insurance scheme would provide strength to the poor and deprived classes in the society which could not afford secondary and tertiary care. This yojana will be implemented through health and wellness centers that are to be developed in the primary health center or sub-center in the village and that will provide preventive, promotive and curative care for non-communicable diseases, dental, mental, geriatric care, palliative care, etc. These centers would be equipped with basic medical tests for hypertension, diabetic and cancer, and they are connected to the district hospital for advanced telemedical consultations. The government has aims to set up 1,50,000 health and wellness centers across the country by the year 2022. The expenditure incurred in premium payment will be shared between central and state governments in a specified ratio as per Ministry of Finance guidelines in vogue. The total expenditure will depend on actual market determined premium paid in states, union territories where ABNHPM will be implemented through insurance companies, in states and union territories where the scheme will be implemented in trust society mode. The central share of funds will be provided based on actual expenditure or premium ceiling in the predetermined ratio. Beauty of the scheme is that the beneficiaries can avail of services anywhere in India. That is, an eligible card holder family from Haryana can get surgery done even in Tamil Nadu. Ayushman Bharat scheme will lead to timely treatments, improvements in health outcomes, patient satisfaction, improvement in productivity and efficiency, job creation, thus leading to an improvement in the quality of life.